We need to build broad acceptance amongst our people of the vaccine program and to vigorously tackle misinformation and misunderstanding. To do this, we must ourselves be disciplined in our public pronouncements, ensuring that we speak accurately and we speak clearly, basing our pronouncements on facts, and if it is on medical issues, on science and medical evidence. Our planning and preparedness for future crises must be improved. This must include investment in our own vaccine development and production capacity. And this is when we need to have African solutions for African problems.
Tonight we pay tribute to the late minister in the presidency, Jackson Mthembu, who was laid to rest this past weekend as we recognize his contribution to the fight against COVID-19, having been the face of government's fight against the virus. May his soul rest in peace. Now, questions have been raised about why South Africa is paying more than what European countries are paying for doses of COVID-19 vaccine. It has been revealed this week that government is paying close to 80 rand for a dose of Oxford AstraZeneca, while the EU members are paying just over 30 rand. It is also left to be seen if government will meet the deadline of securing the first batch of the AstraZeneca vaccines, which is expected to reach South Africa this week from India's Serum Institute, the world's largest vaccine producer. Experts have warned that a delay in acquiring the vaccine could result in a deadly third wave of the COVID-19 pandemic. Good evening and welcome to Unfiltered. I am Aldrin Simpier. Tonight we ask you, given South Africa's economic muscle within the continent, is government failing its citizens in securing the COVID-19 vaccine? You may join the conversation by using the hashtag SABC Unfiltered. Our guest this evening is Professor Barry Shoop, who is the chair of the Ministerial Committee on COVID-19 Vaccines. We're also joined by Dr. Nasiba Kathrada, and she is the KZN coordinator of the COVID Home Management Team and CEO of the Dr. Katz Weight Loss and Aesthetic Center, as well as the general practitioner. And we're also joined on the line by Dr. Kgosi Letlhapa, president of the Association of Medical Councils of Africa. Okay, let's start the conversation here. I welcome our guest. Dr. Letlhapa, let's start off with you. How would you describe South Africa's procurement of the vaccine, or even the process thereof?
I think, we don't know the detail because we're not sitting in the room. All we hear are rumors of we are overpaying. We don't know what is fact, what is fiction. But we welcome the fact that there are concerted efforts to ensure that we get the vaccine. And we welcome the fact that we've been informed that from as early next week, the vaccine will have landed and it will be made available to society. Mm-hmm. The issues of pricing are just issues of rumor mongering. And I hope that we, being a country that has scarce resources, we're not going to pay more than we should.
Mm-hmm. What would you then say about the process of the procurement itself? Because there has been a lot of conversation as well as debate that we took too long.
I think those issues are, we need to understand that I applaud government for their efforts. We committed to equity. Now, there might be people who are used to inequity, even in our own country, where they want to be elevated above others. And I applaud the government for having joined hands with the rest of the countries in Africa and other global countries in the COVAX system. Mm-hmm. Now, there are people that feel money should speak. If you have more money, you need to be at the front of the queue. That's not equity. So I have absolutely no problems that the government has sought to have solidarity with other nations and that we ensure that we're part of the advocates for equitable distribution around the globe.
Okay, and let's ask Dr. Kathrada. Dr. Kathrada, how would you characterize that procurement process, including what some are saying it was a delay in procuring the vaccine?
Well, I'm working on the front line at the moment with all the doctors, and we are looking for solutions while the vaccine is still here. So it's been a while. We really were hit hard in the second wave, and our group is advocating for the use of ivermectin until the vaccine comes through. And that's the sense that's the group that I represent.
Yeah, and we'll get back to the conversation around ivermectin, but from the sense that you're getting from some of your colleagues, is there a sense of frustration?
Well, we were really looking forward to it because during the first wave, all our hopes were pinned on the vaccine. And we trust that around the world, studies were being done on different types of vaccine. And then here in South Africa, we were going to be getting, because there are so many trials that are being done right here on our South African soil, that we will be getting a good first batch, especially for the rollout for the frontline workers and for the healthcare workers, that we are in good stead to handle the rest of the vaccine rollout. So yes, there is a bit of concern, especially because of the pricing is not an issue. It's about procurement of the correct vaccine and getting the correct information out there, not just to the doctors, but also to the public, because there's a lot of skepticism and there's a lot of worry and people need reassurance. So that is where our role comes in. But we have to first empower the medical practitioners and the doctors so that we are trustworthy enough to give our opinions that we firstly believe in ourselves. So we needed to be able to do that. And I'm not sure that that has fully happened. We get lots of information about this vaccine is coming and that vaccine is coming. But getting the, right now, perhaps a lot of doctors are of the belief when the vaccines are here, then we'll believe it.
Okay, and Professor Shupu is the chairperson of the Ministerial Committee on COVID-19 vaccines, also joining us for the conversation. Prof, just listening into the remarks that you had there, I'm going to give you an opportunity to just quickly react to that before I ask my questions.
Yes, well, thank you very much. I couldn't agree with Dr. Tlhapi more. I think the kind of problem, the nub of the problem really is one of equity. I think if we really look at what has happened is that the high-income countries have grabbed vaccine. They've kind of vacuumed up far more than actually what they needed. In fact, many countries have kind of ordered more than twice or three, sometimes even 5 times their population. They've kind of grabbed vaccine at a very early stage when the vaccines were still undergoing trials. And at that stage, it was always kind of wise looking back in retrospect, retrospectively. But at that stage, of course, we didn't know what could we really afford to put down that kind of money at risk? And unfortunately, our economy is not what it is. It's not equal to those of the high-income countries. We do have checks and balances, and of course, it does tie up the administration of finances because of our economic situation. So we were not in a position. I think the state president has said that we were not in a position, as the high-income countries were, to kind of put down deposits. I think it would come to about 2.5 billion rand at risk. So we were in a way left behind. And now, of course, the government, and I agree with Dr. Tlhapi, that I think we need to commend particularly the Department of Health for all their efforts to kind of secure the vaccines which have been secured. I think the kind of fault and the kind of blame in my mind, and I said it on numerous occasions, the blame is the system, because vaccines should not be treated like any other commodities. Vaccines are not baked beans, and vaccines are not timber for construction. Vaccines can only be of benefit to the whole world, the entire world, whether you're poor, whether you're a low-income country, a middle-income country, or a high-income country. Vaccines will only be of benefit to the high-income countries if all the world has vaccines. Because it's not going to help that they're going to be protected with vaccines while still large proportions of the world, the virus is still circulating. They're still going to be vulnerable to that virus being imported in. And not only that, the virus will keep on circulating unhindered by vaccine, and that's where it's going to pick up the variants. That's where it's going to pick up the mutations. So it's not only altruism which should motivate. That alone should, of course, do it. But over and above that, it's just sensibility. They really kind of thought carefully, epidemiologically, virologically. They would realize that to control a pandemic, you have to vaccinate and protect as soon as possible, as quickly as possible, the entire globe,
Yep.
not just the high-income countries.
Okay, Prof, let's just quickly go to a break. When we come back, we'll continue this conversation around equity. Actually, just a few moments ago, this was one of the topics that we had the WHO Director, Tedros Ghebreyesus, touching on, that this issue of equity needs to be dealt with, where you have wealthy countries already having procured vaccinations and also starting the process of inoculation. That conversation just after this.
The day-to-day changes have to do with delays in this signature, delays in that, but we are short of the date that we have actually agreed upon. We're still on course because the issue was to target January, and we haven't got any reason to worry about that change. So until we get to the end of January, we mustn't think that there's anything that's gone wrong. But secondly, we did say that as soon as the vaccines come, we will then start, the vaccination program in February. Our plans are on course. Again, that we will be able to take our health workers through on that program. We're anticipating 1 million vials, and then next month we'll be expecting another 500,000. And so we were saying that the rest of the dosages will be announced as the agreements are confirmed.
And welcome back. I'm joined this evening by Professor Barry Shoup, who is the chairperson of the Ministerial Committee on COVID-19 Vaccines, also joined by Dr. Nasiba Kathrada, and she is the KZN coordinator of the COVID Home Management Team and also CEO of the Dr. Katz Weight Loss and Aesthetics Center, as well as a general practitioner. We're also joined by Dr. Kgosi Letlhapa, who is the president of the Association of Medical Councils of Africa. Professor Shoup, let's start off with you. Can we still say that we are on track for the 1 million doses of vaccines to arrive at least by the end of the month, considering what AstraZeneca said, that it cut its supply to the EU by at least 60%?
Yes, my understanding is that that we will be receiving the 1 million doses by the end of the week, or end of the month, end of the week, and the 500,000 doses next month. I haven't heard anything to the contrary.
Mm-hmm. Okay, so we receive the doses by the end of the month. Then what happens? What's the plan?
Well, the plan is to roll out the vaccine to the highest priority group, which is the healthcare workers. So all the structures are being put into place to roll it out to the healthcare workers, and then I think that's going to be the first stage of the vaccine rollout.
Okay, so Dr. Kathrada, you said earlier on you haven't received any information, and your colleagues as well haven't received any information around the vaccine that would be used and as well administering the vaccine. Is that correct?
No. Oh, sorry.
Apologies.
Sorry. And no, I didn't say that. I said that the information that comes through, that filters through, keeps changing.
Okay.
And we here in KZN, we were hit hard with the second wave. And if you are seeing 60 to 80 COVID positive patients a day, you are struggling to find a bed. There is no time to really read up on what's going to happen. And from the snippets that we've got, because I've been managing a team trying to manage patients at home, we know that there have been calls for private practitioners to join in the vaccine program, where we would register and learn how to give the vaccines, when they will be given out, et cetera, et cetera. But it's a quite an intensive rollout process. And right now, like I said, there are doctors who are struggling to even finish off seeing patients, and ward rounds are finishing at 8, 9 at night. How do you come back home and then start reading paperwork upon paperwork and attending a Zoom meeting to decide, am I going to get involved? Am I not going to get involved? And the vaccine rollout program cannot happen with the public sector by itself. We need collaboration. Public and private sector need to work together so that everybody can get the vaccine timelessly in the order that it was supposed to be set out. Okay,
so where's the hurdle? Sorry, Dr. Kathrada, where would you say the hurdle is?
Well, from the beginning of the pandemic, the one thing that I learned was communication and comprehension are two different things. And as much as we've seen leaflets and flyers, it is a really difficult situation, and there's no blame game, there's nobody to blame. We are living in unprecedented times, and the only certain thing about this pandemic is its uncertainty.
Yeah.
And I can see when it came to the protocols of the COVID-19, about wearing your mask or not wearing your mask, by the time for example, the quarantine time, 14 days, filtered down to healthcare workers, it had already changed. Then something else happened, it's already changed. I don't really know, we've got such wide infrastructure. We are living in a fishbowl right now. Perhaps we needed to take the bull by the horns, choose one person in each province or perhaps in each place and say, you're in charge there, this is what we're doing, get the information to them timelessly, and then from there filter it out. By now, we should have got a network ready so the messages go out. When it comes from government, this is what's happening, something changes. We were supposed to get 1 million vaccines, we only got 500,000. Send the message out, this is what's going to happen. And I don't know, I see we've sort of missed that boat where the communication lines are, especially between public and private sector. It seems to be a bit smoky or hazy, to say the least.
Okay, and Dr. Litlapa, let's hear from you. Is this concerning at all that Dr. Kathrada speaks about a network, but that network is not existing currently, and considering that we have until the end of this week for that vaccine to arrive?
Yeah, I share the concern about the rollout because there are many facilities that we could utilize. If we mobilized every general practitioner and every pharmacy and every nursing practice in the country, we could get to the numbers that we need. If we had organized the fact that we vaccinate on a daily basis, children go to be vaccinated, we should have started defining who are these healthcare workers that we're talking about. We should have asked them to register at multiple points where they could register, either with your family practitioner, with a nurse practitioner, at a pharmacy, or at a public health care clinic. We should have collated the registers of where the healthcare workers have chosen to go for their vaccines. We should be knowing who should be receiving how many doses in accordance with the people that are being prioritized that have registered.
Yeah.
And those type of things we are not seeing, we're not hearing of them. This is where the government should have been going, to the frontline practitioners, not to medical aids and other big giants, so that the people that take care of the people are the ones that would help you vaccinate as many people as possible.
Okay, when we come back, we're going to get Professor Ship to respond to that, and also the letter that was written by the President this morning, where he says, for its part, government will work on improving all its channels of communication, because that has been a major problem. That conversation just after this. And welcome back. Let's go straight to Professor Ship. Just your response then to what Dr. Litlapa had to say there earlier on. And also perhaps you can give us some insights why government decided to go the route of speaking with the pharmaceuticals. And Dr. Litlapa says instead of the frontline workers.
Yeah, thanks. I'm not sure I really can respond because I'm not part of the Department of Health. I'm not employed by them. I'm not part of them. I'm not paid by them.
Sure.
So I can just.
But you've got some insights, I'd like to believe.
I've heard. Sorry.
I'm saying that I'm sure you've got some insights.
Well, no, not really. The insights I've got is really from the top down, not from the peripheral. And I can sympathize with the frustrations that both Dr. Kathrada and Dr. Litlapa have expressed. Maybe the organization hasn't filtered down peripherally as it should have. I know there is quite an extensive, and this I'm really just reflecting on presentations I've heard, quite extensive structures which have been put in place, combining the private sector, the business sector, the medical aid industry, and the Department of Health, and the government and Department of Health. Actually, various departments in the government. And certainly the presentations look very intricate. There's electronic data monitoring systems, there's et cetera. But if it's not translated down to where it actually counts, which is right at the peripheral, at the interface of the recipients of the vaccine, then obviously that needs to be addressed. But unfortunately, I can't really kind of comment beyond that.
Which you'd like to delve into what the immediate task will then have to be?
Well, I guess the immediate task would be to liaise with the front line and incorporate that constituency into the organization. If there's a lack there, that's got to be identified and it's got to be addressed.
Okay, and Dr. Litlapa, from some of your constituents and some of your members, what are you hearing about their frustrations around this lack of information as well as miscommunication?
I think I'm an individual. I'm in private practice. I'm no longer an office bearer. So I speak just as a practitioner, as a citizen. And that's where it should be. That by this time, those that are frontline healthcare workers should have received a notification to say, these are the possible places where you can get your vaccine. Have you registered with it? None of that is out there. I might not be considered a frontliner. I'm an ophthalmologist in private practice. Most of the GPs that are out there, they are frontline health workers.
Yeah.
They need to be part of those that are being vaccinated. Have they been communicated with to say, where would you like to have your vaccine?
Would you be able to say, Dr. Litlapa, what sort of information you have received, though?
Well, as an individual practicing doctor, I haven't received any.
Wow.
In the public space, I haven't seen any. There's community health workers. I haven't seen any communication to say, community health workers, this is where you go to get your vaccine.
Oh.
That's what we're talking about. Maybe it's being done. And if it's being done and it's not being disseminated, we can't even mobilize and talk to people about the advantages of vaccinating. We can't deal with the anti-vaxxers because we are not being engaged. Can you imagine if you engage the 5,000 or 10,000 GPs, they would be able to talk to their patients about the benefits of vaccination, et cetera, and they'll help with that campaign. You know, it's this thing. Business and medical aid should be about the funding of the vaccines, not about who is going to get it where. They must be helping government with getting the resources. The government must be the one that gets it distributed to where the people go for their care.
Okay, when we come back, we're going to ask Dr. Kathrada the same question, considering that she also works with community members. So that conversation just after this. Unfortunately, we have to say goodbye to our SABC 3 viewers, but the conversation continues on the SABC News channel on 404. And welcome back to Unfiltered. Remember that you can be part of our conversations via social media using the hashtag SABC Unfiltered. Let me bring into the conversation Dr. Kathrada again. Dr. Kathrada, as the KZN coordinator of COVID home management team, what are some of the issues that you're dealing with, considering that there is this lack of information that seems to be filtering through from the state?
Well, the reason why we started the home management team was right in the beginning of the pandemic when we were in lockdown 5. Because I specialize in weight loss, I had some time when I closed my practice to become involved in a group of volunteer doctors. And we were taking phone calls from across the country. So I was able to get a bird's eye view of what is going on. And what I found, as much as there was not information going to the public, there was even less information going out to general practitioners. Because general practitioners as a whole work in isolation. We each have our own private practices, and there's never been a need for general practitioners to collaborate on a daily basis. And that's when I started the home management team. And in our team, we've got physicians, anesthetists, general practitioners, dietitians, chiropractors, physiotherapists, nurses, across the board, healthcare workers who are looking for some place for information, some place to discuss, some place to find some common ground and to get information that was sorely lacking because firstly, this is a pandemic, it's unprecedented. Nobody had the answers, but working together as a group, we found that we could collaborate and help each other out. So we have discussions on a daily basis regarding patients, regarding management. I help to procure an oxygen concentrator, pulse oximeter, get a nurse going out to a person's home. And that is the one thing that we found is that we've had to rely on each other a lot because there is no other source of information. If somebody reads a good article, they post it in the group. If somebody had an interesting case or somebody found success with a patient, that is how we built our network and that is how we helped each other and supported each other through this pandemic. And that is what the home management team was all about, and is all about.
So there's one component, and then component is the lack of information. But then there's another one, which is also the misinformation. And speaking here to the president's point that he raises in the letter, that what you try to do is that you try to encourage as many South Africans as possible to take this vaccine. However, though, with the lack of information that's currently out there, and also with the conspiracies and the misinformation, I guess it makes the job even much harder.
Correct, definitely much harder. And the thing is, when it comes to the vaccines, if you're looking at somebody telling us that use steroids at this part of the treatment, we've known steroids, we've known it's about what it's about, we can anticipate side effects because it's something that's been used. But when it comes to a vaccine that is something completely unknown, an unknown vaccine, you know, we first have to get the trust of the healthcare practitioners, of the healthcare workers, the frontline workers, those who are expected to take the first lot of vaccine. That is where the communication should have been first, because if those people are going to be able to filter it down to the rest of the population. And if those people are so busy right now in the middle of the pandemic, seeing such sick patients, you know, we barely get to catch up on chats when it comes to 8, 9 at night. Everybody gets to talk to each other. But it would make so much of sense if there were these short little blurbs saying, this is the practitioner, you know, we need you, we want you. These are your options for vaccines. This is what you can do. This is where, I mean, I get a daily SMS, a COVID alert SMS. As a normal person, I get an SMS saying, you know, what's happening with COVID-19, the numbers are going up, etc., etc. I've never once got an SMS saying something about here are your options for a vaccine. Oof. I'm not even talking about as a doctor. I'm talking about as a South African citizen. I get warnings and news about COVID-19 regularly, every day, you know, on the SMSs that we get, but never once to say, what do you think about a vaccine? Would you take a vaccine? Then we can test the sentiment, you know, around what's going on. And you must remember that the vaccine rollout will be so much easier if you get buy-in from the people. Yeah. You get buy-in from the people when you get buy-in from the healthcare workers, because those are the people that they trust, because that is the person that's not only going to advise them taking the vaccine, but also going to administer the vaccine.
Okay. Professor Shoop, I don't know if you'd be able to tell us how many people do we plan to inoculate or vaccinate every day? If you were to reach that 65%.
I'm sorry, I didn't get your full question.
Sorry, this is for Professor Shoop. Do you know how many people we plan to vaccinate each and every day if we were to meet the deadline of the end of the year of having 67% of the population vaccinated?
Yeah, I think it's been calculated between 15 and 30,000 a day. I think that's the figure that I recall to try and reach that target. The target would be, as you say, 68% of the entire population. So it's not quite 68% of sorry, 68% of the adult population. I beg your pardon, cancel that. 68% of the adult population. Okay. I think that comes to about 15 to 30,000.
All right. Let me just quickly read some of the tweets that you've sent through to the SABC News handle, including using the hashtag SABC News Unfiltered. Here's some of those tweets that have come through. Her Majesty Buntle says that it will cost less than 7 billion rand for 58 million doses if we are broke. So where is the 500 billion or money from the Solidarity Fund and the money Tito was cutting from national expenditures? Okay. And I think this is Tetley, who says that South Africa is broke. It doesn't have the money for basics. It has been broke and indebted even before the coronavirus. And this is Kat Satingalo, who says this vaccine operation is from billionaires. They have it all planned out. The vaccines will be available to all 193 United Nations member states. The lack of funding narrative is a strategy to manipulate people's consciousness. And this is really what you're dealing with, Dr. Litlapa.
Yes, we just need an equitable system. You know, you remember we've just come out of 2020 where there was George Floyd and Black Lives Matter. So we can't get into a situation where when we talk about vaccines, it's rich lives matter. As Professor Shoop has said, in terms of vaccination, all lives matter. Yeah. If you can't vaccinate all of us, none of us will be safe. And we need to ensure that that is carried out. Yeah. This notion that we don't have the money, this would be the biggest investment that we could make, and we will get the greatest return. If you look at the fact that just today, we recorded 300 deaths, COVID-related deaths from yesterday. That's a huge number. So we need to ensure that this goes to where it is meant to go. We need to ensure that we eradicate queue jumping. We eradicate classism around the issues of the vaccine. And there should be clarity about who's going to go first. There's other information. If we're getting 1 million doses, are we going to, if it's a 2-dose vaccine, are we giving 500, keeping the other 500 for the second dose, or are we aiming to vaccinate 1 million people, will get the second doses later? Yeah. Those issues are issues that need to be communicated so that we know what the experts have advised the government on and what the government has decided in terms of the rollout.
Actually, Dr. Litlapa, this morning, the minister was on Morning Live and indicated that the first batch of vaccines will come and those people will be vaccinated, the frontline workers will be vaccinated, and then between 6 weeks after the vaccine, the government has to make sure that it has enough for the second dose, because you need 2 doses for this for the AstraZeneca vaccine.
So I guess those are things that Prof. Shub can comment on. Yeah. But those things need to be quite clear. If we say we're having 1.2 million frontline health workers, so there'll be 300 spare, what do we do with those? You know, if we're getting 1.5 million vaccines. Let's just communicate transparently and fully, as has been done with COVID so far.
Okay, and when we come back, we bring in the conversation about ivermectin. Could it be the solution as it stands at the moment? There are some doctors that are petitioning SAFRA to say that this is a vaccine, that rather this is a drug that we can use in the meantime. Is this the solution to the COVID-19 crisis that the country currently faces, including what's happening on the continent? And welcome back to Unfiltered with me, Aldrin St. Pierre. We're focusing on government's rollout plan on the COVID-19 vaccines. We understand that by the end of this week, we should get the Pfizer vaccine, at least 1 million doses of that. However, though, there has been a conversation that's been happening in the medical fraternity, and this is around ivermectin. And Dr. Kathrada, you are one of those who wrote that letter around why you say that, for instance, requiring each and every doctor to submit a Section 21 becomes, I don't know if you use the word ridiculous, but it is quite demanding.
Well, I actually wrote the letter myself. It was a personal experience. I didn't realize that so many other doctors had the same sentiment. So 600 doctors, close to 700 have now, in support of the letter, have sent me messages, and now we've got a list of 600. But I did mention the Section 21 application, and I did say it was ridiculous. I applied for 2 last week. I have not yet got a response from SAFRA, even acknowledging receipt of my Section 21. And yet we were told if you apply for Section 21, within 48 hours you'll get a turnaround. I have not even received an acknowledgement of receipt yet. Imagine if I had to do 60 of those a day. A pointless task, firstly, because I didn't get a response. And secondly, at 300 Rand per application. And when you go to the SAFRA site to try and apply for Section 21, the first thing they ask you is for payment. Then you have to do in the patient's details, etc., etc. So it is a ridiculous enterprise to be asking us to apply for Section 21 for such a safe drug, especially in this crisis. Okay. And that is why I wrote my letter to the President.
So just for the benefit of our viewers as well, those who may not know how ivermectin works and probably what it could help a patient who has COVID-19, can you just take us through that?
Okay, so ivermectin firstly is not a new drug. It was founded in the 1960s by Satoshi Omura, and it is a drug that has been used in humans for lice, for strongyloides, for parasites, and so it has been used. Except in South Africa, in order for you to use it, even for those things for humans, you have to apply for Section 21. But it also has been used worldwide for viruses and bacteria, because the mechanism of action of ivermectin is that it gets into the cell. Whether it's a virus, a parasite, or a bacteria, it gets into the cell and it unravels the RNA, thus rendering the virus or the bacteria unable to replicate. And we know that the problem with COVID-19 is the rapid replication of the virus giving you a cytokine storm. So if you take the ivermectin early on and you stop the cytokine storm, we can save thousands of lives.
Okay, Professor Shoup, was there any application, at least to the ministerial committee advising on vaccines, to say that probably this is the way to go in the meantime?
I'm sorry, I didn't get your full question.
Sorry, this is for Professor Shoup. I don't know if you got that, Professor Shoup.
No, I did get that.
Yeah.
No, this is not really, doesn't really involve. There's another MAC. There's what we call, I guess, the main MAC, and they certainly have considered ivermectin. It's not considered by the MAC, which considers vaccines, because clearly it's not vaccines, it's a drug.
Yeah.
I do sit on that MAC as well. I know they have issued an advisory. I'm not on that clinical side, and I'm not a clinician, but so I can just report what the clinicians have said, and they've reviewed the data, and I think and I'm just reporting what they're saying, it's not my own view, that they've requested that a well-controlled trial needs to demonstrate efficacy and safety. Now, I think this is what SAPRA has required, that they are still awaiting a well-controlled trial to kind of demonstrate. And their kind of feeling, and I'm just really kind of saying, I'm echoing what their requirements are, is that they are the custodian of safety and efficacy of any drug or procedure or instrument or diagnostic test which is used in the country. And I believe that there are controlled trials which are being evaluated at the moment, and I think that data is being awaited for them to be able to make that assessment.
Okay.
In order to license the drug.
Okay, just a final word.
Can I just make
from
a
you.
comment?
Okay, Dr. Litlap.
I'd just like to caution my colleagues about the challenges that they may be creating for themselves. If you use a medicine that is not registered and you were reported to the council, you'd have a lot of explaining to do. If you had a patient that died and they claim that they died because of the ivermectin and you are giving them ivermectin, you'd end up in a precarious position. We have a bloodthirsty criminal system. We have a colleague that is now being taken to the High Court, being charged with murder for practicing medicine. If you did one of this and that patient sued you, you'd have no defense in front of your peers. You'd have put your future in jeopardy. The way things are going, you could be charged with murder by the NPA.
Is that even if you have a Section 21 approval?
Yes, you must go with the Section 21 approval. If you don't have it, what you'd be doing would be seen as an assault because you are not practicing medicine, you are not using a registered product. No matter how good intentioned you are, you will end up in trouble. But more importantly, we had challenges during the AIDS era about the presidency being involved in medical affairs. So I would seriously caution against anybody writing to a lay person to make medical decisions. When it comes to medical matters, the president of this country is a lay person. And to go to him is to diminish us as a profession and would be asking for trouble.
Sorry, with all due respect.
Let it go to the relevant authorities so that we protect, we encourage the president that if it is medical, let it stay as a professional matter and let it go to the relevant bodies. I agree with the fact that the SAPRA should be chastised. If it promises a 48-hour turnaround time or 24-hour turnaround time, they need to be reported to the minister for not doing that so that they could be brought to book.
Okay, quick
Let
bite
us
there, Dr.
not destroy
Katarara.
the processes, protect us as a profession.
So with all due respect, my letter to the president was saying that he needs to appoint a committee to confirm that the drug was safe. That was my letter about. My letter said, dear President, Honorable President, give the hope back to the people and trust the medical practitioners to make the correct decision. My letter to him was not to approve the drug. My letter to him was a request to have an urgent council set up, just like he did for the vaccines, just like they did the NCC and they did the MAC, was to have an urgent council. I wasn't even saying to check whether the drug is effective. I said SAPRA's 3 tenets were safety, efficacy, and quality. So if it's a safe drug, if it's been around for 40 years and the black market is now flooded with it, I said, give it back, the control back to us as healthcare professionals, so we can give it to the right people at the right time in the correct doses, and we can get it off the black market. I was not encouraging the president to make a decision. I was asking him to give us back the control by employing people to make a quick decision about the safety of the drug and get it off the black market, because that's where it is and that's where the problem is. I was not asking him to make a decision.
Okay, can I just make a caution? We had a similar issue with hydrochloroquine, where somebody even imported huge amounts of hydrochloroquine and was arrested. President Trump was promoting remdesivir. Let us leave things to due process. If things can be expedited in terms of the vaccine being developed in a month, we can get SAPRA to be more efficient in their processes. We should be speaking to SAPRA, to its board, and to the minister to ensure that they are fit for purpose and they have quick turnaround times.
Okay, Dr. Shoup, you have the last word on this one.
Can I come in there as well? I totally agree with Dr. Tlhapi. I think if there's an inefficient turnaround time, that's another matter, as he said. But I think there are bodies which have looked at ivermectin, from SAPRA, from the MAC, the general, not our MAC, but the general MAC, and very professional bodies. And I think in all fairness to SAPRA is actually wanting to find that data. They're actually reaching out. I don't think I don't think that they're blocking it. I don't think they're blocking for any purpose other than they are just looking for verifiable, authentic data.
Yeah. Thank you so much for that, Barry Shoup.
Because I think that is their mandate. The mandate is to be the watchdog for safety and efficacy.
And that's what they've indicated as well. I see that the University of the Free State has said that they are applying to do clinical trials on ivermectin. But really appreciate your time,
That's
Professor
great.
Barry
That's
Shoup, as
terrific.
well as Dr. Khosile Tlhapa and Dr. Nasipi Katrada. Thank you so much for your time. Really appreciate it. We've come to the end of the program. Thank you so much for watching Unfiltered with me, Aldrin St. Pierre. See you again next week, same time, same place, from me and the rest of the team. Enjoy the rest of your evening. Bye-bye.